am Dr. Shaniece Bickham, Assistant Professor of Mass Communication at Nicholls State University, located in Thibodaux, Louisiana. I, along with my co-author, Dr. Diane of the University of Kentucky, recently published The Public's Perceptions of Government Officials' Communication in the Wake of the COVID-19 Pandemic in the Journal of Creative Communication. This study examined whether the public's credibility, perceptions, and trust in government, along with message exposure, influenced their adherence to information about the government, about stay-at-home orders, social distancing, and COVID-19 testing. Two theories were used for this study. They were the source credibility theory and the situational crisis communication theory. We used survey research methodology to explore 4 research questions. Research question 1, are government officials at one particular level of government perceived as more credible than at other levels during a crisis? Research question 2, does frequency of message exposure influence credibility perceptions of government officials during a crisis? Research question 3, do credibility perceptions of government officials influence respondents' behavior as it relates to adhering to the stay-at-home order, social distancing, and COVID-19 testing? And research question 4, does pre-established trust influence the credibility perceptions of government officials during a crisis? The study used the survey research method to gather data from U.S. residents about their exposure to messages related to the COVID-19 pandemic from government officials at the local, state, and federal levels. Participants were recruited for an online survey through sponsored Facebook posts that targeted Facebook users who were U.S. residents and 18 years old and above. Frequency analysis from the study revealed that most respondents strongly agreed or somewhat agreed that they trusted information received from the government about public health issues prior to the COVID-19 outbreak. Similarly, results showed that an overwhelming majority of survey respondents relied on local, state, and federal government officials for important information about public health issues before the first stay-at-home order. Once the stay-at-home order began, most of the respondents continued to rely on the government at various levels for pertinent information. This study included an analysis of survey results, inclusive of findings that detailed pre-established trust in government officials in the U.S. at the start of the COVID-19 pandemic, and whether that trust changed as the public grappled with life under initial stay-at-home orders. When examining credibility perceptions at the local, state, and federal levels, the results suggested that local and state government officials were deemed most trustworthy, while federal government officials were deemed least trustworthy in comparison. Results from the study also showed that trust in government prior to a crisis played a significant role in whether the public would deem information credible during the said crisis. This study also revealed that trust after a crisis, in this case after the first stay-at-home orders were lifted, can also differ depending on the government's response. Results from this study offered strategies that could be adhered to in the wake of a crisis, particularly by government officials. This study showed that the public's level of trust at the onset of a crisis influences credibility perceptions during a crisis. For this reason, strategies identified through this study could also be applied to other public health crises, as well as to other crises related to natural disasters or economic downturns. With this consideration, government officials at the local, state, and federal levels should actively monitor their trust among the public throughout their tenure. I hope that this video has been informative and that you learned more about public's perceptions of government officials at the wake of the COVID-19 pandemic in the U.S.